Hey, Dr. Deb Schreibman here, and we are standing in front of Lake Pointe Wellness Center, and this is our beautiful new integrative practice that we opened a couple of months ago, and I want to give you a tour of our office, so come with me. This is the front door. We're headed in right now. And this is our waiting room. This is our front desk, so when you come into our office, you will check in right here with whoever is sitting here, and then you'll get all the great care that you're going to get, and you're going to check out right here. But for now, we're going to head toward the spa area of our office, which I call Serenity Row. So come with me. Sometimes I actually still turn the wrong way because I'm getting used to this maze and this beautiful place. So this here is Serenity Row, and this is where our acupuncturist, our esthetician, and our amazing massage therapists work their magic. Let's go see some of the rooms. This is where our acupuncture and massage happens. Acupuncture is pretty amazing. I am a migraine headache survivor, and I also have degenerative disc disease, which is severe in my neck. And sometimes I'll come into the office and I'll go, "Oh, Dr. Matt, my neck is killing me." And he'll say, "Here, lay down." And he puts a couple of needles in me, and immediately the pain is gone. It's pretty amazing the stuff that Dr. Matt does with just a little bit of needles and some amazing education. This here is our esthetician's room. Every time I walk in here, I go, she is pretty unbelievable. She uses lots of organic and natural products to help with our skin. And I know as we age, we lose collagen, we lose elasticity, we get wrinkles, we get age spots from all the sun, and our esthetician can really help with that. Let's keep moving over here. This room right here is our, I know it doesn't look like it, but this is going to be our blood lab, where we can draw blood and we can process urine here. And if you keep coming in, we are actually going to be transitioning this room to a hydration station where we'll be able to do vitamin IV therapy, B12 shots, all kinds of different shots for those of you who have lost sex drive, who are gaining weight, who have hormone imbalances, who just don't feel good, your energy is terrible, or for kids who are playing sports and they're out in the 100 degrees out here in Atlanta and they just dehydrate. So instead of going to the emergency room and spending $2,000 to get a couple IVs, we can do it right here for you. And that will be up and running very, very soon, probably 2 weeks. So we're pretty excited about that. And as far as I know, I don't think there are any in this area. So make your appointments because we're gonna be booked. This is one of our massage rooms in here as well. So I know most people are really familiar with massage therapy, but massage therapy really helps with relaxing muscles, especially when you have things like sciatica, degenerative disc disease, neck pain. You ever wake up and you go, "Oh, I have a crick in my neck. I think I slept wrong." Well, you really didn't sleep wrong. It's something that had probably been going on a long time, but pain is the last symptom you feel. It's also the first to go away, thankfully. And massage therapy really helps make a difference in relaxing those muscles and relieving pain. Also helps you to hold your adjustments longer, helps with anxiety, stress relief, and all kinds of different things. This is our therapy room, pretty signed therapy room. And in here, we have several different therapeutic tables. The one right here over at the window, this is called the spinal decompression table. This table really helps to heal spines from spinal stenosis, from degenerative disc disease, from herniated discs and bulging discs, all the things that you go to the doctor and they say, "Ooh, you're just gonna have to have injections, you're gonna have to have surgery." You know, surgery, in my opinion, is really a last resort. You don't wanna have to surgery unless you need it. And you know what, there are times you need it, but you wanna try everything that you can possibly try before you do surgery. So spinal decompression oftentimes helps keep people out of surgery. And I have had people who have had failed back surgery come in and do spinal decompression and do amazingly well. We also have what people call our water table. It's a hot water massage table, and you just lay on it and it's got jets and it feels amazing. We relax your muscles, sometimes before a massage, sometimes after an adjustment, sometimes before decompression. And then this right here is called an intersegmental spinal traction table. And this intersegmental table is often known as the roller table, where it rolls up and down the back and it just helps open up between each segment in the spine, and it takes pressure off the nerve, pumps toxins out, fresh blood in, and we get lots and lots of pain relief from that. All right, we're gonna head down our center hallway here. We have a functional medicine program in our office, so we're going to be headed to our functional medicine wellness office. So this is our case manager for our functional medicine program. What is functional medicine, you ask? Well, there's a big difference between functional medicine and conventional medicine. Conventional medicine is where we look at a problem by doing some labs and then we write a prescription for it, or we do surgery for it. Well, when you're a functional medicine practitioner, what you do is you look at the underlying cause of the problem. And when we do that, we are often able to, husband, he needs some functional medicine, I'm pretty sure. Yeah, so functional medicine looks at the underlying cause of the problem instead of continuing to cover up a symptom with a drug, or instead of continuing to alter a lab with a drug. So what do we see? We see people with type 2 diabetes reduce their medications and often get off of those medications. We see people with hypothyroid, hyperthyroid, even Hashimoto's disease, which yes, we know is an autoimmunity. We also know that with autoimmunity, you can never reverse the autoimmunity. However, we can reverse the effects that that autoimmunity is having on your body, and oftentimes reduce those medications or get you off of those medications as well. We help people lose weight. We have people who are on high blood pressure medicine, high cholesterol medicine, get off of those medicines. And you know what is really an interesting one? How about acid reflux or GERD? People often think that acid reflux and GERD is caused because you have too much stomach acid. So what do? They give you a medication to squash that stomach acid to make the pain go away. But you know what? You're creating a vicious cycle when you do that. Because when you have acid reflux or indigestion or that pain that you think is a heart attack, what that really means is that you don't have enough stomach acid. So what happens is you eat food and it goes and it sits in your gut. And if you don't have enough stomach acid and digestive enzymes to break that food down for you, it sits there and rots and putrefies, and then the acid feeling comes up. So we take that medication and it squashes that acid, but it also squashes your stomach acid even more and it makes it worse. So what do? We take medication. Why not look at the underlying cause of the problem, which is not enough stomach acid? Give you stomach acid, give you digestive enzymes, and guess what happens? You get off that omeprazole, or you get off that Prilosec, and your gut actually heals and you feel better. So this is just a couple of the things that we do in our functional medicine programs. And I'm gonna just take you down this hallway here. A lot of people in our community don't know that we actually have full digital x-ray capability. So even if you're not a patient of ours, you can come into our office. We can take digital x-rays for you. We can send you out with a disc, and then you can take it to your doctor if you need to. So it's pretty incredible. It takes 2 seconds. We can x-ray anything you need x-rays and we can just send it on for you. If you don't have health insurance, don't worry about it, because we have really, really inexpensive cash prices that are so affordable that anybody can take them. So instead of actually going to, up the road to one of those imaging places where it's so expensive, we really take care of you so you can get the care that you need. This is one of my favorite places in the office. This is our supplement store, I call it, but it's really my supplement area where a lot of the magic happens over here. This is where we store the stuff that we need to do the right testing, because what I have found in conventional medicine and with that conventional approach, oftentimes our doctors have to prove medical necessity. They will only do things that are, quote, medically necessary because that's the only thing the insurance will pay for. In my world, in that functional world, when we pay for the things that we need, and we get what we need instead of just what the insurance pays for. So you actually get better because we can do any test and every test. And let me tell you something, these tests are not $5,000, they're not $4,000, they're not $3,000. They are so affordable, and each test is different price, but you get what you need, and then we get the information, and then we fix you. So we've got all kinds of saliva testing. Remember, we have that blood lab, so we can do blood and urine in the office now. We have TENS units. We have micronutrient tests where we test your body's absorption of all of your nutrients, because a lot of times you can be getting your nutrients in, but your body's just not breaking it down. So then we have to figure out, why isn't your body breaking it down? Are you lacking an enzyme to break it down? Is it a genetic mutation that you have? Are we going to always have to supplement you with it? Is it going to be a different form of the supplement that we need to give you so that your body can absorb it and use it? So people who are exhausted, people who are not sleeping well, if it's not a hormone imbalance, which 99% of the time it is, so we test the hormones, then it could be just malabsorption. You're not getting the nutrients in, and we just fix that through diet, sometimes a few supplements, and voila, you feel way better. So this is just a couple of the things that we do here in our supplement closet, and I'm going to take you down into my little wellness office over here. And this is my wellness office, and this is where I meet with my patients every week and talk about progress and obstacles and road bumps, things that we need to do to change lifestyle so that we get permanent changes and not just, I lose weight, I gain weight, I lose weight, I gain weight, that yo-yo. So this is where we get a lot of education and a lot of one-on-one time with Dr. Deb. So we also do classes in our office, because what I have found is if I tell someone, go home and exercise, guess what happens? They don't. If I tell someone, go home and go to the gym, guess what happens? They don't, right? Our medical doctors say, go home, lose weight and exercise. What do? You join Weight Watchers or some of the system. You exercise because you join the gym. You go like 5 times and then you never go again. So what we do is we actually teach you how to exercise in the office, and we also teach you how to cook and eat healthy. And we teach you that just because it's healthy doesn't mean it has to taste bad. So we do smoothies, we do juicing, we do bone broth, we do bulletproof coffee. We have an area right over here where we have a Chick-fil-A soda that we're going to go ahead and get rid of. This is not ours. This is a visitor in our office drinking Chick-fil-A. So this is where we have a lot of our classes where we sit down and talk about hormone balancing, how to read your labs. Wouldn't it be amazing if you could actually get labs off that portal, where they tell you to go? They don't even call you anymore and say, hey, your labs are in or you need to come back in. So you go to that portal, and what we do is teach you, this is what it means when we look at this. This is what it means when we look at that. This is what high means. This is what low means. You should be concerned. You shouldn't be concerned. And you will know how to fix it because you get that through a lot of the classes that we do. We do nutrition classes and cooking classes. We actually go to the gym and teach you how to exercise within whatever boundaries you have. We go to the grocery store. We go to the farm and we do a farm tour so you can see what it's like to be part of a co-op and get healthy, in-season, locally grown food. Eggs. Have you ever had eggs straight from that chicken? Oh my goodness, it is the best. So this is where we have some of our cooking classes. We actually had a class today on golden milk, which was so good. It was turmeric and collagen latte, cinnamon, unsweetened coconut milk, and a little bit of stevia and a piece of fruit, and it was unbelievable, and it's healthy, and it's just creamy and smooth, and you would never know that it wasn't a milkshake, so it's pretty interesting. Come this way. In here we have our chiropractic case manager's office. So when you come into our office, wave Trace, say hi, this is Tracy, she's our office manager. When you come into our office, what we like to do, and I think this really sets us apart and makes us different from other offices that you'll go into, is we come in, we talk to you, we go through your history, we evaluate your feet, how you're standing, how your feet are hitting the ground, and how it's affecting the rest of your body. We talk about your history, anything and everything. We gather as much information as we can, and then we take you into our exam room, which I'm going to show you pretty soon, and teach you, this is what's happened to your body, and this is what we need to do to make it better. But the thing that really sets us apart is then on your next visit, we will sit down with you, we will give you what we call a report of findings, and we'll tell you, this is what I think it's gonna take for you to get better, and these are your options. It's pretty amazing. So we don't just say, come in 3 times a week for the rest of your life. So let's keep walking this way. We're going to head toward our adjusting rooms. So in our office, we have 4 adjusting rooms, and we have electrical stimulation, we have ultrasound, we have all kinds of different therapies. So before or after you get your adjustment, we're able to help do these therapies that will help relax your muscles, help pump the toxins out, help bring that fresh blood in to stimulate that healing process. We help people who have, sprained ankles. We do ultrasound, which is pretty amazing. We can't see babies with our ultrasound, unfortunately. That would be amazing because I love babies. But we help heal sprains and strains. This is our adjusting table. We also have equipment that we can use, instruments to do adjusting. So let's say you've already had back surgery and you think you can't get adjusted. You can get adjusted, and you can get adjusted safely using one of our instruments. And a lot of people don't know that. They think once you have surgery, that's it. And chiropractic care is for everybody. I had the pleasure of adjusting a little 3-week-old baby today. She was kind of fussy when I first got her, and after her adjustment, she was, and then she actually fell asleep in my arms, which is pretty amazing. So kids can get adjusted, adults can get adjusted. It's never too late. Elderly people can get adjusted. When you receive a chiropractic adjustment, a lot of people think it's only for pain, but really it's not just for pain. Pain is a symptom that's been there for a very long time, or it's a symptom of an issue that has been there for a very long time, and usually by the time you hurt, it takes a long time to get better. The best time to actually come in for an adjustment is when you don't hurt, because what an adjustment does is it impacts your central nervous system. And what does your central nervous system do? It controls every other system in your body: your musculoskeletal system, your genitourinary system, your cardiovascular system, your endocrine system, for those of you out there who have hormone imbalances like type 2 diabetes. Hey, guess what? I'm going to give you a little pearl right now too. What is type 2 diabetes? Do you think that it's a blood sugar disease? It is not a blood sugar disease. It's a hormone imbalance. It's your pancreas that is not producing enough of the hormone insulin, or it overproduces insulin. So that's a little pearl for you, but that is your genitourinary system, your musculoskeletal system, your endocrine system. All of the different systems in your body can be affected by having a chiropractic adjustment, by affecting that central nervous system. So that's pretty cool too. So the best time to come in is when you're not hurting. This is one of our other adjusting rooms in here, and we have all of the same things in here: ultrasound, electrical stimulation. We also do a technique called scraping, which uses this little metal tool. Let me see, I have one right here. This works incredibly well for plantar fasciitis, for tennis elbow, and it's really easy. All you do is this. You just take this and you scrape the muscle both ways, and it breaks up adhesions and scar tissue. And people get up off the table and they go, oh, I can actually stand up on my feet. It's pretty incredible. So let's go this way. This is our exam room. So this is the room that you will be in on your first visit when you come in to see us. And this room is pretty interesting too, because we have this huge TV. And when my patients come in, they say, oh, Dr. Deb, what do you do? Watch TV in here? And then I press the button, and guess what happens? X-rays. Life-size x-rays, so you can actually see what is going on in your body. And for those of you who are my age or older and you can't see anymore, you can actually see what those x-rays really look like. We are electronics. We do everything that we can electronically, so we try to really keep the paperwork down for everybody and save our trees, so that's pretty fun too. All right, come this way. We're gonna sneak through the door that we're not really supposed to sneak through, but we're gonna go through anyway, right back here into our lobby. And this is our bathroom. It's my favorite bathroom, shiplap. That's for you, Joanna Gaines. There it is, some shiplap. Just teasing. All right. So here we are back in our waiting room. It is beautiful and serene and quiet. You probably won't spend too much time in here because that is my biggest pet peeve, letting anybody sit in a waiting room. So I hope you enjoyed the tour today, and we're looking forward to seeing you. And if you have any questions about anything, don't hesitate to reach out to me. Dr. Deb at lakepointewellness.com, or you can go to our website, www.feelbetterhere.com.